Good morning, everyone, and thanks for joining us today for an update on COVID-19. As we indicated earlier this year, when the public health emergency was lifted, the availability of effective vaccines, and combined with the milder variant Omicron, have changed how we respond to COVID-19. Omicron continues to be the dominant COVID-19 variant circulating across the world, and there are many sublineages of Omicron in circulation. These sublineages are small changes or mutations to the Omicron virus, and depending on what part of the virus has changed, it may or may not change its characteristics, such as how easily it's transmitted, how severe the disease is, or how well vaccines protect against it. Of all the Omicron subvariants that we have had come our way this year, none have behaved drastically different from the original Omicron variant that emerged in late 2021. Indeed, we have seen several surges, but this was and continues to be expected as we adapt to life with COVID-19. We were able to lift public health measures and allow the resumption of societal activities while riding out these surges, and our province's healthcare system was not overwhelmed as a result of this approach. Looking at the evidence from other provinces and territories, we know that easing isolation requirements for positive cases can be done without significantly impacting health system capacity. So based on all of these factors, it is our assessment that we are now in a place we can further ease restrictions for case and contact management of COVID-19. So effective on 12/01 on Monday, if you develop symptoms of COVID-19, you may choose to use a rapid test if available, and if the rapid test is negative and your symptoms persist, another rapid test should be used 48 hours later. Please note that this has changed from the 72-hour interval we had recommended up to now, as new evidence has emerged indicating that 48 hours is optimal. Regardless of a positive or negative test result, anyone with symptoms of COVID-19 should isolate at home until symptoms have improved with no fever for at least 24 hours. And for 10 days after symptoms started, individuals should wear a mask, avoid interacting with high-risk individuals or groups, and avoid visits to high-risk settings such as non-essential visits to hospitals or long-term care facilities. There are exceptions for healthcare workers in regional health authorities, and we would ask that they contact their Occupational Health and Safety Department for guidance. If you are a close contact of a person with COVID-19 and you do not have symptoms, you do not have to isolate, but should monitor for symptoms. We are exploring options to make rapid tests more accessible across the province, and we'll have more information on that in the coming days. As always, we continue to monitor the epidemiology of COVID-19 and can adjust measures to respond appropriately. Earlier this month, we began administering Moderna's bivalent vaccine to those aged 18 and older, and anyone 12 and older who were considered to have, who were at high risk for severe COVID-19 disease. We now have an additional bivalent vaccine product available. Pfizer's bivalent vaccine was authorized for use by Health Canada on October 7th for those aged 12 and older. We will start administering this product on Friday, October 28th. Health Canada's authorization of these vaccines means that they are both safe and effective. And at this time, there have been no studies published to indicate one is more or less effective than the other. They're simply two different products that specifically target the Omicron variant. We do not have information on the duration of protection for the bivalent vaccines, and it will take some time for that real-world evidence to emerge, as was the case with our first COVID-19 vaccines. Provinces and territories are working closely with the Public Health Agency of Canada and with the National Advisory Committee on Immunization to monitor surveillance data for bivalent vaccines. So when you book your next COVID vaccine, we do recommend booking an appointment for a bivalent vaccine if you are eligible. A bivalent Omicron-containing vaccine is the preferred vaccine product for booster doses for anyone aged 12 years and older. We also recommend accepting the product that is offered to you at the time of your appointment. As some reminders, all individuals 5 years of age and older should receive a fall booster dose of COVID-19 vaccine at least 20 weeks from their last vaccine dose, regardless of the number of doses previously received. And if you have had a recent COVID-19 infection, you should wait until at least 3 months has passed before getting your next vaccine. And once it has been 3 months after infection and 20 weeks after your last vaccine, you should get your next dose. Individuals 5 to 11 years of age receiving a booster dose would receive the original COVID-19 vaccine at this time. And it is safe to receive a COVID-19 vaccine and the seasonal influenza vaccine at the same time for individuals aged 5 years and older. Flu shots are now available, and you can book an appointment by visiting timefortheshot.ca or from your physician or local pharmacy. As I've indicated before, this will be our first year with COVID and influenza circulating at the same time with restrictions lifted. It is possible to contract both COVID and influenza at the same time, so getting your annual flu shot and ensuring that you are up to date with your COVID-19 vaccination is important to help avoid severe illness. Make the time and make the choice to get your vaccines. These are our best tools of defense against COVID-19 and influenza. Thank you, and I'll now take questions from the media.
Dr. Fitzgerald, I just want to clarify. So if you get COVID, instead of isolate for a week, it's now just isolate until you no longer have fever and your symptoms are on the decline.
Yes,
correct?
That's correct.
So that means if someone, for example, had very minor symptoms that only lasted for a day or two, they may only have to isolate for a couple of days.
Yeah, that's correct.
And so how concerned are you, though, that there may be people who are still infectious who then go back to work or go back out into the community and spread the virus more?
Yeah, so I mean, certainly that's, that's always a concern with this approach, and it's always a concern regardless, with any infectious disease, a respiratory disease especially. I think what we know right now is that as you're starting to feel better, especially with people who are vaccinated and especially with the Omicron variant, which is causing less severe disease, we know that when those severe symptoms have passed, the risk of infection does go down. And so, as long as people are wearing masks, we're trying to mitigate that risk as much as possible by having people wear masks for 10 days after the onset of their symptoms and reducing that risk when they're around other people. So, it's a balance, as it always is, between making sure we have the right policies in place to protect the individuals and society, as well as allowing society to get back to as normal a function as possible. And we've certainly heard that having people out of the workforce for an extended period of time has been very difficult.
I keep hearing from people that there's, or at least there's the impression for some reason that COVID in the province is rampant right now. I keep hearing that word rampant, but I don't have any indication from anywhere that that's actually the case. Can you give a sense of the real case counts that you're aware of, or whether it is, quote unquote rampant?
So we've certainly been seeing sort of a low level of, or not a low level, but like a plateau level of COVID for the past couple of months for sure, that level has been about the same. We've had a few little peaks and valleys in there, but it's been about the same for the last little while. Certainly, we are seeing a little uptick in the last week or so, but nothing drastic. And, our hospitalizations are holding fairly steady. But we do expect it, as people move back inside, we probably will see a slight increase in cases, and we may see an increase in hospitalizations as well. That's why it's so important for everybody to try to do the best they can to protect themselves for the best that they can and get their vaccinations.
You mentioned making rapid tests more accessible to the public. How do you plan on doing that?
So we've got some plans in place, and I can't really, they're still not finalized. So, but we certainly are looking at, we heard what people were saying last spring. So we certainly want to make it as available as possible and as equitably as possible. So hopefully we will have some more information on that in the very near future.
Are enough people wearing masks right now?
Good question. I'd like to see more people wearing masks. We've certainly been recommending that people wear masks, especially when they're in situations where there may be an increased risk for spread. So if you're in an indoor place where, there are lots of people, there may not be great ventilation, and you're going to be in close quarters for an extended period of time, then, as part of your risk assessment, then, if there is COVID in the room, then there may be a risk for increased spread of COVID. So wearing your mask is certainly one way to reduce that risk or to mitigate that risk. Obviously we've been trying to reinforce that people have to make that risk assessment for themselves. For people who've recently had COVID or people who are recently vaccinated, they may not feel that risk is quite as high for them. But if it has been some time since you've had COVID or been vaccinated, then we know that protection against transmission of the virus wanes. So we would certainly want you to take that into consideration when you're thinking about whether or not you need to wear a mask.
With this new relaxation of some of these rules, I know that for a lot of people, they look at if they have the sniffles or if they might have symptoms. With things being relaxed to the point that they are now, they might just say no, and they're not going to follow these rules. Why is it important for people to still follow these guidelines?
So, for us in public health, stay home if you're feeling unwell, especially with respiratory illnesses or infectious diseases, has always been something that we've recommended to reduce the spread. What we know right now is that while you personally may not have an increased risk for COVID or for severe COVID, that doesn't mean that somebody in your sphere might not, somebody in your workplace, so you want to make sure that you're taking those measures to try to reduce the risk of spread, while still allowing for some of that movement and things that have to happen in society for society to function. So we feel this strikes that balance as best possible at this point in time. But it is still important to remember that COVID-19 and influenza can still be pretty significant diseases for a lot of people, and that we all need to do our part to try to reduce the risk of spread of that as much as possible.
What has uptake been like with the fall vaccination campaign so far?
So we have seen uptake, certainly once the bivalent became available, we did see an increase in appointments for that, and in many of the, certainly in the larger areas and larger clinics, we're seeing a good uptake. I don't have exact numbers with me today, though, so if you want that, we can certainly get that for you.
Is there a specific reason why, and I'm sure there is, but the bivalent, for instance, say someone hasn't gotten a vaccine for whatever reason, or they're on their second dose right now. Is there a specific reason as to why that wouldn't be offered as the second dose? Is it like a lower, no?
No, sorry. I was creating the answer in my head as you were talking. But the reason is just simply because the studies weren't done in people who hadn't already received that primary series, right? Or there just wasn't. So many people have thankfully made the choice to be vaccinated that, it was just very difficult to get those studies done in people who weren't. And so the studies have been done in people who were getting them after their primary series. And so that's why the recommendations can only be there at this point. I'm sure people are looking at that now and realizing it, but it is just basically based on the evidence that's available.
I want to ask about long COVID. Statistics Canada this week came out with some numbers showing about 15% of people that get COVID have reported symptoms lasting longer than 3 months. How much of a concern is long COVID, and is there a plan to try and address it, as that puts an added burden on the healthcare system especially? Yeah,
so certainly what we know about long COVID now, or post-COVID syndrome, is that it certainly more people, and I think there were some recent studies, and forgive me, I can't quote them right off at the moment, but there have been some recent studies that showed that certainly earlier in the pandemic it appeared to be that these post-COVID symptoms were more prominent than they are now with Omicron, and possibly as a result of vaccination reducing severe disease. So we are obviously looking at post-COVID syndrome, and we anytime we have an infectious disease that's causing these sorts of symptoms afterwards, we want to make sure that we're exploring that well, and that we understand it well. And so I'm not, it tends to get out of the realm of public health as you're dealing with people who are having issues after having an infection, that gets more into the realm of acute care and a little bit out of the realm of public health. So I'm not necessarily aware of all the conversations that are happening around that, but if you want to follow up, we can certainly get more information on that, Peter.
Does it concern you though that, because obviously the more people that get COVID, the more people you're going to have with long COVID. So does it concern you that as we are easing even isolation requirements, yes, it may not overwhelm the healthcare system, but it still may mean more people get COVID and more people end up with these longer, more debilitating symptoms?
Yeah, I mean, that's always a concern. There's just, again, it comes back to that balance of being able to say, what do we need to do to protect the public versus, the societal function. And, that's societal function is very important as well from a public health perspective. So, we need to strike that balance. And so we certainly don't want to see that people are developing long-term symptoms. That's not the goal, obviously, but we have to strike that balance as best we can. And many infectious diseases people have symptoms for quite some time after. Influenza can do that as well, and we certainly hear about people who take a month to 2 months to recover from a really bad influenza or a bad pneumonia or whatever the case may be. So some of these, it's not unheard of that this would happen with other infectious diseases as well.
I was looking at the recommendations from the National Advisory Committee on Immunization. Something I found very curious. After this was for the under 5, to be clear.
Okay.
After the first dose, and they did say, to approach this data with caution, but it said that it was negative. It was actually a negative percent in terms of protection against infection, infection, which I just found confusing. I didn't quite understand. And again, they did say that data, for various reasons, need to be approached with caution. But does that mean that you're more likely, or the kids under 5 are more likely after the first dose? Or?
So I'd have to go back and read exactly what was said. It can be very nuanced, so I'm not clear exactly what part of it you're referring to. So if you want to send that over afterwards, you certainly can, and I can try to define that a little bit clearer. But so negative doesn't always mean that you're going to have a negative result. It just may mean that you didn't. It was a negative correlation, which is a little bit different, right? So but I'd have to see exactly what the part of it is that you're referring to.
Public Health is supposed to, during the fall sitting of the legislature, table a report on the pandemic response. Just wondering if you can give us an update on that and when we can expect to see that report.
So that report has been tabled. Yeah. So, but, I don't know what happens to it after that. So you'll have to, but it's been done and it's been presented.
As well, last time we spoke, I talked about, or asked you about the uptake of the under 5 vaccine. At the time, it was the summer, and perhaps people were on vacation and not making appointments, that sort of thing. It's now a little bit further down the road, and it's still quite low. It's at 10.1%, I think, as of Wednesday, or at least the data as of Wednesday. It seems very gradual for that group. Do you have any indication as to why that might be?
Yeah, I don't think we're any different than anywhere else in that regard. I think we're seeing that across the country. I think it's difficult to say. I don't know that there's been any specific, survey that has looked at that. I think a fair number of kids have actually come down with COVID, and so perhaps some of it may be waiting for infection, that interval between infection and when they can get their dosages. So to some degree it may be that, so I think we'd have to wait until you know, we have a little bit more information about that. But we certainly do recommend, it is still important to get your vaccine. It is important in that group, they can still get flu shot as well. So we would recommend that, you know, to reduce the risk of severe disease, that both doses of the COVID vaccine be done for primary series and as well as the flu vaccine. Good, thanks.